Hi, everybody. Welcome to our Family Matters interview series today. We're excited to have Dr. Steve Simmons joining us. Welcome, Dr. Simmons.
Hello, thank you for having me.
Thank you for taking the time to join. Our families will be interested to hear this topic today. I think it's really relevant to how we can all manage our health, how we can make those lifestyle changes that are really important to support our brain health and finding ways to reduce those risk factors for cognitive decline. So I think this will be a great topic for our families. Dr. Simmons, let's start with a little bit about you. Can you tell everybody a little bit about yourself, where you've worked and some of your experiences when I know you work with a lot of older adults and families?
Yes, I grew up in Tennessee. I went to the medical school in the University of Tennessee, which is in Memphis. After that, I completed an internal medicine residency program in Denver, Colorado, and actually had a chance to do a job that you can't find anywhere anymore. As an internist, I had an office next to the hospital, and I would round on my patients before and after office hours, see people in both settings. And that's a dying profession now, as we all know. You either
Mhm.
have to be in the hospital or out. Excuse me. That gave me a unique opportunity to see more of a total internal medicine type of a practice. Now I moved to the Washington D.C. area in 1998. I was married and I've had kids. I've been here ever since. I spent 10 years working in Kaiser's urgent care department, and then after that, I worked as a house call physician in Washington D.C.,
Interesting.
Maryland, and Virginia. This began my experience in helping people age in place and understanding that uh, the conditions that put a person in the home and make it where they really can't get back out tends to be the neurologic degenerative diseases, of which dementia is the lion's share, and of that, Alzheimer's is the majority cause within dementia. I worked in assisted living after that, had a practice in memory communities, which really gave me a lot of experience working with dementia. And before you knew it, I was working a lot with dementia in the area because that's where the need was. I found that families really, it's a family illness. No disease has such a unique character like dementia, and it could be Alzheimer's or any type. But a dementing illness, unlike others, is an illness of an entire family, not just a person.
I'm sure our families would agree with that statement.
I
Absolutely.
would. It's something I've had the chance to agree to professionally and personally within my own family.
Yeah, and I know, I imagine you've had lots of discussions with older adults and their family members, about dementia, how to manage the cognitive decline component of that disease, but also how to manage lifestyle choices and other medical conditions. I know a lot of our older adults have, multiple medical conditions that can all contribute to their overall health and wellness. Can you talk a little bit today about the differences between sort of some of those chronic conditions or diagnoses that we know are out there that can impact overall health? And then what about lifestyle choices? Those things we can control, those things we might be able to impact to make our health a little bit better.
That that's an interesting question. I think I would start by separating out chronic conditions from those that are clearly impacted by lifestyle choices, obesity, diabetes, hypertension, even in cholesterol diseases. They do tend to relate quite well to lifestyle choices, what you eat, how you move your body. Whereas the misfortune of developing a rare neurologic disease, a Parkinson's perhaps, that would be an example of a disease that we don't know the lifestyle modifications at this time that you could choose or not choose in order to not get those diseases. But with Alzheimer's dementia and the second most common cause of dementia, which is vascular dementia, a condition that the generation before mine and doctors would call multi infarct dementia. which I always thought captured the process a little better. You're having multiple small strokes, which leaves you with less brain, and therefore you're incapacitated and demented. The reason I wanted to give that a nod is the risk factors for Alzheimer's and vascular are identical. Smoking, and now we're to lifestyle choices, changes. Uh, Smoking is really at the top of the list. Smoking cigarettes. You've got central abdominal obesity. Notice I didn't just say obesity. It's fascinating that there's such a correlation between who you are in your 50s and who you're going to be in your 70s. Who you are in your 50s with whether you carry extra weight in the middle and whether you'll be able to carry the weight mentally a score of years later. That's a big choice right there.
Interesting. That's really
It's
interesting.
huge. It's huge. And so exercise, all of that impacts things. Are you going to give the signal to your body that you're trying to stick around and be better at using your body tomorrow than today? Or are you going to tell your brain that you've got a body that's it's okay to have less of it tomorrow than today? Those choices impact the direct development of the top two dementias, Alzheimer's and vascular. And also, they impact on whether you get these chronic conditions that then not just feed into dementia, above the neck problems, as it were, but feeds into below the neck problems. Um, Central obesity, you're going to have degenerative joint disease. You're going to be able to move less. You're going to get slower. You're not going to be able to exercise as much. It's you really have to think hard to find a chronic condition that doesn't relate to a lifestyle choice. They're there, and that's why I've talked about Parkinson's, and I'm sure you could we could think of more if we tried. But in relating to how you can make a choice today that impacts who you are tomorrow, that impacts who you'll be years down the road, and whether you'll be there to take whatever you're going to go through today and remember it tomorrow. It's amazing how much that depends on what you do today.
That's really interesting, the relationship between your lifestyle in your 50s and kind of the carryover 20 years later into what you may be experiencing as an older adult. And I know everybody says I need to exercise more, right? Everybody wants to eat a little bit healthier, make better choices. But sometimes it's hard to really change. People aren't sure sort of where to get started or how to incorporate, new habits into their existing routines. What is your advice for someone who's looking for, action steps for how can I really put this into practice? What should they do if they want to start small and work their way up to some bigger changes?
Um, I think we could take a page out of what we're learning now from diets and fads. Um, what about the word sustainability? Are you going to make a choice today that you can continue tomorrow, a month from now, a year from now? If it's not sustainable, then it's a flash in the pan choice. You really need to not get in such a hurry to fix everything now because you're going to mess some things up. You're going to need to look at your overall choices and say, what can I sustain? And then you want to go slow, and you really need to add exercise to it. And if you do, again, that's where it's very important to not get in a hurry. You could get in a hurry, get the tendonitis, fall. You just get muscle strain, and then it takes you out of exercise, and then once you're off the wagon. I'm sure I'm not sure. I'm sure from personal experience. Once you're off the wagon, it's hard to get back home.
For sure. So walk before you run is what I'm hearing you say, both literally
Maybe,
and
yeah, maybe even
figuratively.
crawl. Maybe even if you're not crawling, start crawling. If you're crawling, walk. Try to get an honest assessment to yourself of where you're at. And really, it's not about. Here comes a cliche warning. It's not about the destination. It is the journey. It's not about waking up with a healthy weight, muscle tone. It's about on a daily basis telling your brain that you're trying to stick around. I think you do that with the choices in the exercise and avoidance of a lot of bad habits and just the sustainability of it, the day in, day out nature of it.
Yeah, that's good advice. Start small, small wins. You don't have to run a
Yes.
marathon right out of the gate, you know?
And if weight is a big part of it and you're ready to get exercise, um, ask for help. Pay for help if you have the resources. You could get a trainer. If you've got some kind of a pain, you need to work around it and find an exercise program. Perhaps physical therapy could help.
Hmm.
Um, Try to not go it alone. I can remember, you know, well, I can remember family members as they were getting into a decline. I remember one bought a exercise bike and must have been whatever was on Home Shoppers. Very high up exercise bike she fell off of and hurt
Oh,
herself.
no.
So don't try to fix it by Wednesday. Try to adjust and not get caught up with where you're at, but get caught up with what you're doing today.
Yeah, that's good advice. Yeah, you didn't get there in a day, right? So you're not going to make a
Won't
change
un-
in one day.
you won't unfold it. No, not in a day.
Yeah, that's interesting to think about. Just kind of start somewhere. You mentioned cardiovascular disease and heart health, being connected to the risk for Alzheimer's disease and that cardiovascular system. Can you tell us more about how the presence of a cardiac condition might play a role as a risk factor for dementia and or changes in cognition?
Um, yes, in fact, it's not a challenge to think about what you might say, but what to put first in line. I think everybody has their own image of what a heart condition would be. I think maybe many of us grew up watching characters on TV. It's the big one, Ethel, and all that. But for me, I would start with a heart attack, which is where the arteries that surround your heart are not able to supply blood to the muscle of the heart, and a part of your heart muscle dies. You see, your heart is a pump, and circulation is a circle. So when you circulate your blood, it's in a circle. It's going out oxygenated, coming back looking for some more oxygen, and that heart is just pumping it in that circular fashion. If you lose pump mechanics, you're going to be in a lot of trouble. That's congestive heart failure, and that's where you can start to have a big impact on one of the most important jobs of the heart if you're the brain, and that is give it some blood. See, when the heart's squeezing, it's putting a blood pressure up to the brain. The brain is sensing that and telling the heart how high to make the blood pressure. Like if I think of somebody might have a stroke and their blood pressure is super high, I'm probably right. Especially if it suddenly happens. The brain is telling the heart and the blood vessels, I need more pressure. I'm not getting blood. So there's a connection between the heart and the brain that can never be broken on a circulation basis. You have got to get oxygen into your brain tissue. Your brain cells cannot store oxygen for a rainy minute. I say it that way because they do store glucose for a rainy minute. They can release glucose very quickly if all of a sudden glucose drops, but they can't get the oxygen in there. So brain damage occurs very quickly with no flow, and it can occur very chronically with low flow. So that's talking about the can the heart pump? Can it get blood to the brain? Can the heart pump well because it's not had a heart attack? And you haven't even really talked about valve disease, which is internal dynamics of the heart. Those can cause strokes. And then the real biggie is atrial fibrillation. Atrial fibrillation has a huge statistical correlation with dementia, a lot of vascular, some Alzheimer's, especially if you're not taking anticoagulation. So it's important as we get older to make sure we're seeing our doctors, making sure that we identify heart rhythm problems, pump problems, cardiovascular issues, and blood pressure. If you're constantly having a high blood pressure, it's pounding your organs, including your brain. It's stiffening the arteries, and by the time you get older and your brain's working, your arteries may not be working so good for your brain, and now you're going to start having little mini strokes for nothing, and you're going to really start to have a decline if you get sick. You get a head injury, you're more exposed to quick changes. I have my own concerns about anesthesia. if you're early in Alzheimer's. So it's just the connection, you just cannot separate them from a physical standpoint.
Can you define atrial fibrillation for those who may not be familiar with that term?
I think I can explain it, because one of the things I've started saying when I'm making my clinical rounds now is I'll come away with a stethoscope and I'll tell my patient, you know, you got a really boring heartbeat. I love it. It just sounds so boring. It's as boring as the metronome my piano teacher used to put on the piano. Boring. That is a nice rhythmic heartbeat. If you've ever heard jazz music, where it's just got a beat that's just it goes crazy, it goes in all kinds of directions, fast, slow, and all that. That is a fibrillation. Um, Atrial fibrillation is when it's coming from the top part of your heart. Ventricular fibrillation, which comes from the bottom of the heart, is synonymous with sudden death.
Oh my.
But atrial fibrillation is a rhythm that can cause super fast heart rates and promotes the development of blood clots and can cause stroke. I haven't looked up the numbers recently. I believe the last time I was certified for my internal medicine boards, I think if you don't take blood thinners and you have AFib, each year you have an 8% risk of a stroke that year.
Wow.
And
Alarming.
yes. I think if you added aspirin, it was something like drops it to 4. If you take a real anticoagulation, it's 1. I'm not sure where the numbers are now, but last time I took my board exams, which was 2016, those are the numbers I was remembering or learning. But the risk for stroke is humongous. And you take away from that chaotic jazz beating heart rhythm that's not boring anymore. It doesn't circulate the blood. You've broken the circle. The blood flow decreases to the brain. You can start to have little miniature strokes, especially if you've let your arteries get hard. And just these little things, these little tiny strokes that don't show up on a CAT scan really can have a cumulative effect, which is why I do like that old term, multi-infarct dementia. You get so many tiny little things that you're less, and now you have a dementia incapacity.
There's a lot to think about when you're thinking about heart disease. And these are great questions to ask your primary care doctor when you're going in for your annual physical. If you're experiencing any of these, what is my blood pressure? How does my heartbeat sound? The things that you want to know the information around so that you can be educated about, am I at risk? And are there things that we can do for that? Are there medications to help address some of these issues? Is lifestyle important, or is it a combination of both that will help folks to mitigate some of these risk factors?
I think it's every bit of it. It is. It's making sure that you're not smoking. Again, it's the same things really. You're not smoking. You're exercising. You're trying to continue that circulation, and then you know that's the kind of. See, we're all talking about the physical things, right? Take your blood pressure medicine, because if your blood pressure is high, it's pounding your arteries. It's pounding your brain. I always remember this nephrologist when I was a medical student trying to explain to one of her patients who wouldn't take blood pressure what it was doing to her kidneys. I'll never forget her. It was a big old guy. She was not a big person, and she took her fist and she said, "Every time it's just doing this to your kidneys." That kind of constant pressure, it has an effect. But not all problems really are physical that have an effect on dementia. I think we've got to make sure we mention depression, social skills. You've got to be out there living with other humans. There's some really interesting twin studies that show those that lose socialization. I even think some that were like, if you're married, like one twin got married, the other one didn't. The one that was married didn't get dementia. You hear stories like that.
Wow. I
Um,
think we saw a lot of that during COVID when people were isolated. They
yes.
couldn't engage with their families. They couldn't go to
Yep.
church. They couldn't meet with friends. There was a lot of depression. And, we heard, I know just hearing from older adults and families out in communities who were living in senior living or in a nursing home setting where they couldn't see their family members. they felt that their parent or their loved one declined when they were in that social isolation, that their actual thinking skills, their communication were worse when they finally did see them again after several months. They couldn't believe how much they had changed.
Yeah,
So
and I'll tell you, in assisted living communities, you can always tell somebody that's worked in assisted living if they just have to call it a community. By the way, they are communities, they are homes, not a facility, right? But I was getting into these communities and families weren't, and it was even worse than that. You know, you would have outbreaks, and then you would have to keep people in the room. And in assisted living in this country, 50% of residents of assisted living have some degree of cognitive impairment. Trapping them in the rooms, they weren't going out and listening to the piano. They weren't reading the paper in the lobby, hanging out with other people. They were just trapped in the room, having food brought in like it was like it looked like they were all ordering DoorDash, is what it looked like.
they got
And
the
and and, it,
styrofoam in the
and
bag.
yeah, every time you ran on it, they would just decline. And I can remember that, the impact of that. That was just something that I saw really on a daily basis, and it was quite stunning. Those of my patients who were already in a memory community and they were really advanced. It was like it wormholed them towards the much later stages of Alzheimer's, and you got to see what solitary confinement can do to a person. Really, it was tragic to remember some of those days.
But that was what the first thing I thought of when you mentioned depression and
Hmm.
social isolation. Those were some of the two biggest complaints of older adults during that time was they went hand in hand, right? They had the changes in mood because they couldn't see anyone and because they weren't connecting with others. So I think
Yeah,
that's a really good point to, stay connected to your community, your family, your friends, your neighbors, have those social relationships.
yeah, I can remember just talking about that. And then today, I saw a patient today who I'd taken care of, almost a year ago, and I didn't realize how much the visual of him has stuck with me. Was he had COVID, and he was allowed to get to a certain line in his room, and I remember him opening the door, and his wife was going to come visit him. She was going to stand a certain distance away, and just the mix of joy and disgust and sadness that it couldn't be more. um, and I think we can all tell our own stories. I was just visiting my mother through a window in a nursing home, so I really felt it, and you saw the impact. And again, I've said it, it's not just professional, it's personal. I've seen it on both ends. I've experienced it, from both ends, as the family member and the doctor.
Oh, absolutely. Yeah. I mean, if you're the one outside the window, you really feel, that sense of sadness and missing your family member, and they're feeling it too. It's really,
Absolutely.
I know we're almost out of time, so we probably have time for one more quick question. You've given us a lot of good things to think about. We're talking about, health conditions and managing your health, connecting with your doctor, making sure you're aware of any risk factors that you have. We're talking about lifestyle choices, things you can control, maybe getting more physically active, even if it's small steps, making positive changes in your diet and your nutrition to help with that weight management component, and then keeping social, keeping out, engaged with those around you. Are there any other proactive steps or things folks can be thinking about when they're sort of taking stock of what am I doing today and what could I be doing better? Is there anything else that you think would be worth mentioning for folks to be thinking about when they're looking at overall health and health maintenance?
Yes, in fact, there's a weird one that really hasn't fit with the idea of circulation or mood, and it's hearing. And I want to be clear, I didn't say vision, because that doesn't really affect the development of dementia. But to not treat or manage a hearing impairment is to increase the risk of Alzheimer's dementia. There are a lot of studies, and in England, the United Kingdom, they really ran with this, and they noticed, that you could take a person with hearing impairment, correct it, and then they would test higher on the ability to perform their own instrumental activities of daily living, banking, uh, that which requires a lot of executive function, making your brain come together and pull things together. But also the flip side was true is if you don't and you don't correct it, there are MRI studies that show your hippocampus shrinks over time. And I think there's a really good explanation for it. I don't think you really have to get a calculator out and explain it. The hearing nerve, which is the eighth cranial nerve, when it leaves your ears and it goes in towards the middle of your brain and ends up bringing the signals to where they're bringing the signals, it's right next door to the hippocampus. It's right where you have that part of your brain which stimulates short-term memory. And so the hearing, to ignore a hearing problem, um, you know, that's a really big mistake for a lot of people. And it's so easy to fix early. Now I saw a patient this week. She had lost her multi-thousand-dollar hearing aids, and
Oh,
she was
no.
running $100 version from the internet, and she didn't say "huh" one time to me. And so I guess that one's the curveball that most people don't see coming. And the reason I said not vision is because in the United Kingdom they were so encouraged by the results from fixing hearing that they tried to fix vision. That didn't help a bit. Your vision's in the back of your brain. It's nowhere near the hippocampus, I guess. Perhaps that's what's going on. But don't ignore hearing. And then again, it's interesting as we were talking, this idea of improving mood and the head, the brain, the heart, the head, the heart. Um, I've always liked Hawkeye from MASH. I don't know. I'm sure some of the listeners could
Oh, I'm
talk
sure. That's a classic.
doctors, right? Um, but I'll tell you, Alan Alda gave a commencement address to Columbia Medical School in the 80s. And I've always taken to heart. I read the speech, and I've loved the way he closed it. He told these medical students to remember that the head bone's connected to the heart bone, and that they were to never let them come apart. And this is an interesting comment because this is true on a physical sense and in a emotive sense. Um, and you've got to be able to be in your world with your people, hearing things, sensing things, feeling things. And all of that adds into the lifestyle choices and then the normal things. Don't get diabetes, cholesterol, exercise, don't smoke. All of that matters. And what you do now really affects what you do later. And it's never too late to start. If you're saying, oh no, I missed my 50s, do the best you can in your 60s. You 70s, 80s. It's never too late to start.
And I think that is our parting comment for folks to take away. It's never too late to start. Thank you so much.
Oh,
Thank
you're
you,
welcome.
Dr. Simmons, for taking the time to join our families today. We really appreciate you sharing your time and your expertise with us. And we'll be back with another Family Matters next month. Thanks,
Thank you.
everybody. Thanks for taking the time to join.